What is neurodiversity?
What is it about these people?
Dyslexia.
Autism spectrum.
ADHD.
Gifted.
Dysgraphia.
All brains are different.
It's okay to be who you are.
This is the Neurodiversity Podcast.
Hey everyone, welcome to episode 78. I'm Emily Kircher-Morris. On today's episode, we're talking with Dr. Robert Jason Grant. He created Ott Play Therapy, and we're talking today about what it means to be a neurodiversity-affirming therapist and how to help neurodivergent people and their families. It's really hard to believe that we are in March again. I'm curious, how have you been doing this year? And how are you doing with the stream of anniversaries that will soon be approaching? We've each experienced a different level of traumatization over the last 12 months, and I want to take a minute and just encourage you to recognize feelings of burnout or overwhelm that you're experiencing. Christine Fonseca spoke with us about dealing with the trauma of the pandemic back in episode 58, and it might be worth a listen. We will link to it in our social media and show notes. Don't forget to connect with us via social media. You can find us on Facebook, Twitter, and Instagram, and you can find all of those links on our website, neurodiversitypodcast.com. Up next.
Hello, everyone. I'm Dr. Robert Jason Grant. I am a licensed mental health professional, also a registered play therapist supervisor.
Stay with us.
Hi, I'm Dave Morris, the executive producer of this podcast. Putting together something like this is a huge endeavor, from planning and booking guests to putting together the finished product to buying equipment, even traveling to get the stories we present. It's a lot of work. As twice exceptional parents of 3 2E kids, my wife Emily and I wanted to start this podcast so we could share our experiences and help others along the way. So my request is this. If you get some benefit from our podcast, would you consider becoming a Neurodiversity Podcast patron? Just $1 or $2 a month can really add up, and not only would you be helping defray costs, you become eligible for some members-only perks. Listening to our podcast is a free experience, and it always will be. Chipping in will help us continue bringing compelling content to listeners around the world. Go to patreon.com/neurodiversity or go to neurodiversitypodcast.com and click support at the top of the page. And thanks.
Let's dig into play therapy, its history, and some new twists with Dr. Robert Jason Grant. Thanks for being here.
Thanks. I'm excited to be here. So thank you so much for reaching out. What an exciting podcast. I love it.
Tell me a little bit about Ott Play Therapy.
I'm the creator of a play therapy approach called Ott Play Therapy, which is an integrative family play therapy approach that really focuses on working with autistic children, neurodivergent children, also children with developmental and physical disabilities who have mental health needs. And it's all about using the therapeutic powers of play to work with those children and families.
Why don't you tell us just a little bit about that history of Ott Play Therapy, kind of how it started and how it's going now?
Sure. It's I'll try to keep it brief. So initially, I guess the beginnings would be when I was referred, parent referral. My first client, a child, it's around 5 or 6, who had a diagnosis of autism and some other co-occurring conditions as well, a chromosome disorder, some medical issues. And the family was really struggling to find services to work with him, to work with them, and randomly came to me. And I was doing play therapy, and this was my first experience working with a child with these issues. And it was very different. His presentation, the family's needs, it was all very different from what I was used to, mainly working with neurotypical kids up to that point. So I loved them. I loved him. I loved this family. I felt a lot of connections to them, actually. And so it just really motivated me to find better ways to work with them, because I was doing child-centered play therapy. I was doing some other play therapy ideas, but just not feeling like we were fully tapping into what he needed from me or this process and what the family needed. And so that sent me on a journey to like discover something I could use, tool, method, approach, to work with them better. And then it just kind of all started snowballing. I was learning more and more. I was actually then getting more and more referrals coming to me of autistic children because there was such a high need and no services. And I did feel like I was learning a lot. A lot of things way back then were, these advertised autism treatments, quote unquote, and I'm going to these, and none of them are really based in play therapy. None of them are mental health approaches. I did learn a lot, but it wasn't like I learned anything I could just bring back purely and implement that was really a good fit for me. And so what I did is I started in this idea of this integration of seeing things that looked beneficial, how they applied to play therapy, what was in play therapy already, that, we do something like that in TheraPlay, or child-centered play therapy, and integrating these ideas together in sort of just a protocol that I was going to use. And it did work better. I felt like I was addressing mental health needs better. We were making better progress in those areas. And then it grew again because people wanted to know what I was doing. So I started offering trainings this is what I'm doing, and this is how it's working for me. And then it became more formal, a training guide, then a book, then more trainings. And it's grown sort of organically. The whole idea originally was to find something for me. I wasn't planning on sharing it with anyone else. Wasn't being selfish, just that was not the idea, to create something that would go out, around the world. And I would say that, about 5 years ago, really the shift to making sure that AutPlay was very neurodiversity affirming and informed. Mm-hmm. It wasn't that it wasn't initially, but it also, I don't think I was very mindful of that initially. Play therapy in general tends to be pretty affirming of children and families, just the way it's done, even though it's often not thought of purposefully to do it from a neurodiversity perspective. There are a lot of those components naturally in most play therapy theories and approaches. So there was a lot there, but definitely about 5 years ago, and it really was a result of me starting to work with autistic adult clients and going deeper with them in therapy sessions. I just really started realizing all these really little things that could be modified, adapted, changed, that were going to be more neurodiversity affirming and informed for my kids and my parents that I was working with. So that was a really exciting shift because it felt really good to me. Like it made sense to me.
Yeah. There's definitely a growing awareness within the neurodiversity movement and kind of this push among mental health professionals to limit that pathologizing of neurodivergence. Mm-hmm. And so I'm curious if you can just even talk a little bit more about, as a neurodiversity affirming therapist, like how does that manifest in your work?
Actually, I can sum this up really easy to make it simple for people. What it means is to understand that someone doesn't come to see you because they're autistic. They don't come to see you because they're neurodivergent. That is a part of who they are, and it's a part of what you're going to understand in terms of how you work with them. But they're coming to see you for what? What is the need? Is it that they have a trauma issue? Is it that they're being bullied at school? Is it that they're struggling with their parents' divorce? They're not coming to see you because they're autistic. And that's probably the best way to explain that. That's how you get rid of that issue that we've had, in mental health care with these populations.
Yeah.
And that's a hard shift for people because I think people still think, it's sort of the foundation of what we're set up for across the board is we think in terms of diagnosis. And diagnosis means this problem. And then we address that diagnosis this way and this way because that's what research has told us to do. I mean, this is kind of how it goes with all diagnosis, not just autism and neurodivergent diagnosis. And I think that the problem there is you just lose the person. This is going beyond our topic here, but if it was a neurotypical person with depression and you're just looking at them through their diagnosis, you are just losing the person. And I think that that's the most important thing as mental health professionals. It's okay to understand research. It's okay to get information, but you should always be person first, really, valuing them as a person, valuing their voice. In AutPlay, one of the big things I try to teach all the time is give the child a voice. The child and the parents are partners. They're co-change agents, which means you value them. You value their input. They have a voice in their therapy goals.
Helping them also know themselves and have that autonomy, driving those goals and figuring out what interventions work for them is so powerful because it puts them back in the driver's seat.
I mean, it's a problem everywhere, not just in mental health therapy. Mm-hmm. It might be even a little bit better in mental health therapy than it is in some other settings. And it's not great in mental health therapy. So there's this problem really in most of the settings that a child with autism would go into. They are probably being first looked at, considered, and addressed because they have autism in a way that's looking at it as a problem.
Yeah.
Instead of looking at them as a child, this is part of their identity. Now, what issues are going on that we can help with? Mm-hmm. Again, and you're right, that really ideally would be the philosophy in education settings, in healthcare settings, in mental health settings. And we're a long way from seeing that fully realized. The positive part of that is it's getting better. I mean, there are so many things happening in terms of understanding neurodiversity and what that looks like as application that, weren't even around 10 years ago or being talked about 10 years ago. So there's improvement happening for sure, and that's the positive side. But it's so important to keep getting this message out and people to hear it and understand it and really try to make those changes.
Let's talk a little bit about play therapy in general. I feel like it is something that is generally misunderstood. I mean, it's definitely something that's more than playing board games during counseling sessions.
Yes.
And I think that sometimes there's kind of this lack of awareness about it.
Yeah.
So tell us a little bit about that history and kind of what it really means if somebody is engaged in play therapy.
Play therapy is based in psychological and counseling theory. It's not something that somebody just randomly kind of created or pulled out of the air. Everything that somebody's doing who knows what they're doing in terms of play therapy is based in grounded psychological and counseling theory that's been developmentally adjusted or made appropriate for children. Because obviously our history on psychological and counseling theory is, it was developed on adults. And so we know that kids aren't adults aren't kids. And so there's differences. And so play therapy really recognizes those developmental needs of children and that we work with them, the children, therapeutically, where we can meet them with their developmental levels and their developmental needs.
Yeah.
Play therapy, the term, is an umbrella term. Underneath that are several play therapy theories or approaches. And the Association for Play Therapy recognizes 10 seminal and historically significant play therapy theories and approaches. So when you meet someone who's doing play therapy, they should be able to tell you what play therapy theories and approaches they're working out of, they're using, or they're integrating, and why they're doing that with a particular client. So this is a thoughtful process. Again, it is not just sitting down and let's play a board game. Board games might be a part of the theory or approach that you're using, but there's a purpose and a reason, and those are based in psychological and counseling theory, and they're working toward a therapy goal. And play therapy is appropriate for all children, ages, diagnosis, issue. There's no exception to that. So, a neurotypical child or a neurodivergent child, lots of family therapy focus in play therapy as well. So it's something that I feel is really powerful in terms of a mental health approach for children. And probably what I've discovered as the best thing out there. I'm not paid to promote play therapy. There's real purpose behind this that really understands how play can be beneficial for addressing the mental health needs of children and adolescents and also their families.
Play is the language of children. This is how they communicate. This is how they problem solve. Mm-hmm. If somebody was observing a play therapy session, what might they even see?
So if somebody were to pop in on a play therapy session, it'd probably go back to what play therapy theory is that play therapist working out of in terms of what they'd see. They could see a very purposefully created play therapy space or room, which has toys and materials selected for a specific reason, for a specific therapeutic reason, not, just a collection of random toys. And they may see that the child and the therapist are on the floor and the child is playing with miniatures in a dollhouse in some way, and the therapist is maybe making reflective statements about what the child is doing or what the child is saying. They may observe a play therapy session where the parent is present with the child and the therapist is a little more directive in teaching the parent and child connection games that they're playing together, maybe where they're holding each other's hands and doing a game, or learning how to do attachment-based touch games and exercises. They may go into a therapy session where a child is in front of a sand tray with a lot of miniatures and they're creating a scene in the sand tray. And it may be something that they're coming up with their own, or it may be something that the therapist asks them to create a sand tray that shows fill in the blank, what it's like when you get bullied at school, or maybe just describing you and your family. And then the therapist would process that tray with the child afterwards. So there can be a lot of different looks. They're usually based on, what is the child's needs? What are the therapy goals and what are we working on? And then what play therapy theory or approach am I pulling from or using to help this child with those therapy goals?
If parents are looking for somebody to support their child, what sorts of questions should they ask?
They should certainly ask, what is the therapist's experience working with children, and then also with children with possibly, the presenting issue or need. And they want to be able to hear the therapist provide a good, thorough explanation of their experience, their training, etc. Therapists should even be able to produce proof of a specific training if they're saying that they've had it. So parents really want to make sure that they ask that question. What is the experience here? Listen to the answer and make sure it sounds reasonable and accurate. And also, in terms of play therapy specifically, they can ask, are you a registered play therapist? That is a credential that the Association for Play Therapy provides, and it communicates something. It communicates that they had to meet a certain criteria of training, experience with kids, and supervision to be able to have that registration. So that's always a good question. when we're talking about neurodivergent and or autistic children, I think it's important to ask, what is the experience specifically with working with those kids? And what's your philosophy about how you work with autistic children or neurodivergent children? And then listen to those answers, and if something doesn't seem quite right, you could ask a follow-up question, or you may want to look for someone else.
I think that's important to remember, that finding a clinician, a therapist, to work with your child or your family is a very personal decision. And I did a presentation the other day, and somebody was asking, how do you find that counselor or therapist that clicks with your child? And I thought that's a perfect word for it, because sometimes they'll say, how do I find a therapist who has this specialization or that specialization? But sometimes it's not even so much that specialization as it is that relationship.
Yep.
That's what facilitates the change.
Yes, that comfort level. The child should be comfortable coming in and being with that therapist, and the parent should also feel that relationship and that comfort level too, because there's just so much potential that could be explored and gotten into that's going to need that relationship base in order for it to be effective.
We've been talking a lot about play therapy. I want to just talk a little bit about some of the stigma and misunderstanding about specifically the diagnosis of autism, other types of neurodivergence. There are some that are maybe a little bit more understood or accepted.
Yeah.
But we're really still pushing back against that with autism. What do you feel like are some of the biggest myths that should be dispelled surrounding autism?
That is such, it's like my brain starts flooding with so many things, because there's so many myths, there's so many misunderstandings.
Right.
Two things really stand out. And the first one we've talked about already, which is, a client isn't coming to see you because they're autistic. A child isn't in your special education classroom because they're autistic. I know that's what the document says, but that is not why they're there. Why are they there? That's what you need to find out. What are the needs? The needs isn't, I'm autistic. And I think if we could clear that up, it would be huge. If everybody started, and that really is the neurodiversity paradigm, is that you look at autistic children that way. So if everyone could just start learning that, it would clear up a lot of mislabeling, I think. And then the second thing is a better understanding of the B word, behavior. Well, why do you think you're getting that behavior? Let's go back there, because this really isn't just about stopping a behavior and labeling all these behaviors as bad because, I don't know, somewhere along the line you picked up that you just don't like that behavior, or somebody decided it wasn't an okay behavior. But really stopping and looking at two parts here. One, for most autistic children, if there is a big behavior outburst that's negative, it's probably because they're dysregulated. It's not because they don't want to do your math worksheet. It's not personal because they don't like you. It's not because they're thinking if they throw a fit, they're going to get that piece of candy. It's none of that. It's dysregulated system. It's out of control from head to toe, the thinking, the feeling, the sensory, and they cannot get control. And it's usually the child is the most scared and uncomfortable person in that situation. So just understanding that, look, we've got a dysregulated child here. There's a real reason why this behavior is happening. Let's really focus on what's creating the dysregulation instead of just focusing all our attention on this quote unquote bad or inappropriate behavior. And the second part of that behavior is some behavior that autistic children do is okay.
Yes.
It's not bad just because you haven't seen it before.
Right.
Stimming behavior isn't bad just because you think it looks odd.
Yes.
Right? And so that's the other side.
I think that's the biggest thing. It's like, we need to stop them from flapping their hands or whatever. I'm
Yep.
like, that's a self-regulating behavior.
Yes.
They're doing that because it helps them to regulate their emotions almost always.
I totally agree. And, if it's a stimming behavior, even if it's like, a preference behavior, like you don't have to want to go play with everybody on recess. And that doesn't automatically mean there's something wrong with you, right? I mean, I think there's so many behaviors that just get labeled as problematic, and that's kind of an ableist thing to do, right? And we need to step back and just really, really reframe and take a much better look at behavior when we're talking about autistic children. So if we could change those two things, it would be huge.
I agree. Understanding that what is maybe considered normal is not always what a neurodivergent kid needs.
Right.
They might be perfectly satisfied to sit and read a book during that recess time, and that's fine for them. We don't always need to push them into a situation because we feel like they need it.
Right.
Letting them have some of that autonomy in their life. And of course we want to help them grow. And I don't know, we just have to take it on a case-by-case basis.
Absolutely. Check ourselves. Whether you're neurotypical or even if you're neurodivergent, because your neurodivergent experience may not be the same as somebody else's neurodivergent experience. We just always have to check ourselves with our clients and be like, this isn't about me and this isn't about what I think or some construct I've pulled out of society. This is about this person and who they are, and what they want and what they need.
Yeah. So as we wrap up, I want to get your thoughts. If you were talking to someone who's supporting a neurodivergent person, whether it's their child or a student or a client, what advice would you give?
Oh, what a great question. I think in any setting, from parent to teacher to youth worker to therapist, doesn't matter. If you run across a child who is neurodivergent, then I think one of the most important things you can do is provide that relationship focus with them with this non-judgmental, unconditional regard guide. If you do nothing else but that will be very valuing for them, and it will go a long way in helping them with anything that they need to work on or they're struggling with, even if you're not directly involved in it. Just knowing that they have received that kind of relationship from someone and have that kind of relationship with someone just will be huge.
Thank you, Dr. Grant, for your time today.
Yes.
We really appreciate your expertise.
Thank you. Enjoyed it.
To embrace a neurodiversity affirming mindset, we really need to be in tune with our expectations and constantly asking ourselves, why? Why is it important for a child to stop stimming? Why do we expect certain types of social relationships with other kids? Why are we pushing a certain college or career path? When we ask ourselves why, pay attention to the answer. Are we feeling this because it's something the neurodivergent person wants and needs? Or is it because it's a social expectation and we think things will be better if others perceive the neurodivergent person differently? Who does the intervention help? The neurodivergent person or the people around them? Should we be working to change people to fit into the world, or working to make the world a more accepting place for all types of people, including our quirky, neurodivergent kids? I'm Emily Kircher-Morris. I'll see you next time on the Neurodiversity Podcast.
Our thanks to Dr. Grant. He's on the web at robertjasongrant.com, and you can find links to more of his work on the episode page at neurodiversitypodcast.com. Our thanks to some new supporters of our podcast. Jane and Norman made one-time PayPal donations, and Shane, Michelle, Justin, Christy, Lori, Mel, Jay, and Letha, all new Patreon supporters. They are helping defray the costs of producing and promoting our podcast and making it available to more people. And for that, we are grateful. You can go to neurodiversitypodcast.com and click on support at the top of the page if you'd like to help. I'm executive producer Dave Morris. Get that vaccination so you can stay safe, stay healthy. See you next time. This podcast is a production of Morris Creative Services.